Hi, I'm Dr. Tieche with our MedMinute for the week. So, what I wanted to talk about today, I did not have any questions, but I wanted to talk about a topic that is pressing to me. I love regenerative medicine, and that's where we're using products to help our body heal itself. But there is a dark side to that, unfortunately. The dark side is people are seeing opportunities to capitalize on unsuspecting patients or people who have illnesses has happened throughout time, snake oil salesmen and such. So they're renaming their products, they're misinforming patients about some of the products. And so I really wanted to let people know just buyer beware with some of these things. Stuff has now finally become very regulated and tested and things like that. But before it was the Wild West, every kind of company was making these stem cells. You didn't really know the quality, you didn't know where they came from, you didn't know the sterility, you didn't know the patients that they came from. So they really wanted to rein it up, and it was a good job. But now people are bypassing that system because it's quite expensive to have all these labs that do testing and things like that for our best. So when people are getting different stem cell products, they're using different words. So we're doing tissue transfer, we're doing research grade stuff. And so they're bypassing really the true legit stuff and using these other terms. And so I think you have to be careful when you hear practitioners offering some of the products. And I am not saying that all practitioners that offer these are mischievous, but some are, and they use specialized wording. They're going to do one. Number one is going to be super high pressure sales. That's what it's going to be. It's just going to almost be like a car salesman. Sorry to any car salesman, but it's going to be super high pressure. And the other thing is they're going to use terms that just sound like their product is way better than anyone else's. This is much more potent. It says 10 times the factors of other similar products, or we're going to enroll you in a special study, a research study, so you're going to be able to get these much better factors that are going to work better for you. And so they sound enticing when you hear that, but they're not true. None of those things are true. There's very few studies that are being done with these things, and if they are, they're going to be very well controlled at universities and big centers. Probably in Ocala, there's probably no studies being done like that. So if they're saying that, it always should raise a little bit of a question or concern. When they start talking about the potency of the factor and these numbers, you have to ask them, where are they deriving the data? Who's actually coming up with these numbers? Or are they quantitative? Because we do want, there's ways of counting the factors and counting the numbers. Just by saying something is 10 times more than something else, does it really have it? There should be a spec sheet from the company that produces it to verify that those are really the things that are there. So you want to make sure that what you're getting is really what they're saying. And sometimes more powerful, we think powerful is going to be better. It's not always better with regenerative medicine. The problem is because we want really selective targeting of the factors that we're using for joint repair, ligament, tendon, things like that. But when you start shotgunning out all of the factors and you're saying they're more potent, you may have some of these factors that trigger other responses, inflammatory responses, and things like that. So you can actually make some things worse, increase pain levels, because it really sets off this big cascade of other things going, because the factors heal things on their own, but then they set a cascade into action of other things happening. So we want to make sure that the cascades we're setting up are all good. None of these ones that are creating more inflammatory problems and things like that. So I am a strong believer in regenerative stuff, and we do a fair amount of it. We're fairly cautious with it, but I know that there's been some companies that have come and gone who spend more money on marketing than anything else. And I understand people have to market, but really, and they charge people quite a bit. And it's the products are what they are. Just be cautious. The other thing is the whole overseas hype. I'm going to go overseas and get stem cells, and people hear about the amazing overseas stem cell products, and there's a lot of that stuff on social media. I'm going to go to Costa Rica. I'm going to go to Colombia. I'm going to go to any of these and these people are miracle workers. Well, they're using probably lower quality stem cells than they are in the US, because guess what? Zero regulation down there. And so you start, and again, all of those places may not be bad, but I can tell you, as soon as there's no regulation on practitioners and there's a profit to be made, it's going to be chaos. So the problem is that when these factors are not isolated as well, when they're not cleared out, you run into more allergic reactions, infections, things of that nature. So I just want people to go into that with their eyes open, do their research on it. I'm not saying everyone is bad, but just be a little bit cautious, because one, it's very expensive, and secondly, you're injecting these things into your body. You want to make sure that the product you're getting or your family members are getting are safe and actually going to have some response.